Welcome back to the panel discussion, Women of Washington, Cyber Engineering, sponsored by Booz Allen Hamilton on Federal News Radio 1500 AM and federalnewsradio.com. My guests today are Dr. Stacy Dixon, Deputy Director of IARPA, Jean Schaefer, CISO and Chief of Cyber and Enterprise Operations at the Defense Intelligence Agency, Debbie Bucci, Lead IT Architect at the Department of Health and Human Services, ONC, Naomi Escofri, Chief of Business Operations for the Deputy Assistant Director for Information Operations at the Defense Health Agency, and Trish Goforth, Executive Vice President at Booz Allen Hamilton. So let's move on and talk about some of the more emerging technologies and the cyber challenges that are related to those, or maybe the promise that they hold for helping us in this area of cyber. And Trish, I'm going to start with you. Mobile security continues to be a priority for federal agencies and something that we hear more and more about. How is security being engineered into mobile devices and mobile applications to ensure data and applications remain secure?
Yes, the federal workforce really wants the convenience, that you experience in your day-to-day life through the mobile technology. But obviously there's a lot of sensitive data and enterprise security that has to be addressed. Fortunately, many of the mobile technologies that are available today have been developed with a reasonable set of security controls built in. And so you can come up with security policies that make sure that those are being leveraged, passwords, limitations on data sharing, things like that, encryption. So the mobile device management capabilities can help monitor compliance with those devices to make sure that they are only being used when they are in compliance. We also highly recommend mobile threat detection capabilities so that you can regularly, again, assurance through assessment, make sure that the devices are staying in compliance and that the threats from either the connected network or locally, can be identified. We also find circumstances where very sensitive information, such as financial institution, healthcare, classified environments, those built-in native controls aren't necessarily sufficient. And so we've been looking at ways of providing, if you will, secure mobile devices within closed environments where you still can use that mobile technology, but in a very controlled fashion. And we have a product called District Defend that allows you to implement security controls using RFID and encryption that's based on the location of the platform, so that when it goes beyond that secure perimeter, it's automatically disabled. So again, it provides a little bit of the convenience and access to information collaboration within a closed environment.
So that convenience that you talked about, that's really a key thing. I mean, one of the things that we're going to talk about is recruiting in this age of cyber and cyber engineering and how critical it is. And especially hard, I think, for the government at times, because there are some innate disadvantages you have over the private sector. And one of those might be the fact that it is, because of the sensitivity of the data, it is harder to use things like mobile devices. Jean, how is your agency dealing with that? I mean, at DIA, you've got nothing but sensitive data.
Right. So when you're talking about it in a more sensitive environment, in the classified environment, there's still mobile devices. So just inherently, there's different security that you have to look at from that instance, right? So some of the things when you're talking about mobile is you need to have that on-demand data removal, right? So that if devices do get lost or if you're going outside of a particular area, you want to make sure the remnants of that data that you're trying to protect aren't resident on that mobile device. And that's where you really need for the development of those things to make sure that you're integrating that hardware and that software so closely together, because as soon as that device is powered on, you need to be in that state that you can actually handle that.
So, when I think about mobile devices, if you take that to its extension, it's really the Internet of Things or any connected device now that we have to worry about how we're securing. And understanding how those things work kind of from the inside out is really an important element of how we secure them, is it not? I mean, Debbie, how do you think about those sort of IoT connected devices?
So I don't see that being any different than the idea of having to be able to reverse engineer to understand how devices and systems work to be able to protect them. The difference is the IoT area is growing exponentially, and how do we keep up with all those changes around it?
Yeah, and how about the fact that, you know, we say IoT and immediately you think about maybe a talking refrigerator, but in truth, I mean, a lot of these are very sensitive systems that are, I mean, you can't, you know, you keep reading about, you know, driverless cars and things like that, but there's all sorts of, you know, healthcare devices and lots of devices which now are going to rely on being connected in order to work properly. So what sort of additional challenges do those present? I mean, Naomi, are you guys looking at that at DHA at all?
We are. As we kind of absorb the military treatment facilities into one, we've identified that there's a lot of end user devices, mobile devices that maybe the Army uses, Navy, Air Force. And so we've actually created a process to streamline those devices and kind of get an enterprise look and feel. And what we're doing is when we get that enterprise kind of baseline, what we plan to do is optimize our risk management framework process and make sure that each device can follow within that security parameter. So that's the way that we've addressed it.
How about at IARPA, Stacy? Are you doing anything with the Internet of Things and connected devices?
We are. We haven't necessarily looked at it from a cybersecurity perspective. We're looking at the information that we can obtain from using all sorts of devices and what we can learn about individuals and environments based on the devices that they're wearing, the devices that are situated around them. But from a cybersecurity perspective, though, I think the fact that there are so many and that the security is somewhat unstandard in many of them, we are only learning after they've been implemented and used by millions of people sometimes what they actually can tell us about things that may have been things that we thought were secret in the past. So it's going to be on both the consumers who are using them, the organizations that are creating the devices to really think that through and project what are we giving up, what are we telling people about the world in ways that maybe we didn't realize we were telling them, and be able to figure that out before the information gets in the hand of people who might do something wrong with it.
Absolutely. Debbie,
so
did
when
you?
you're talking about health Internet of Things, it's not just a cyber issue, but it's a safety issue as well. And so the idea that you're to need additional authentication and authorization controls to be able to access these devices, that's where the area of biometrics, facial, and other type of indicators that may be used to employ to help to secure these devices.
Absolutely. I mean, and we're seeing that even now with cell phones, that they're building some of the baseline biometrics in to help secure them. Is your agency, have you done some work with biometrics?
So for ONC, that really more advises on the access of medical records and health. It's more of a national focus instead of a agency focus. So a lot of it is, there has been a move for a long time to have citizens and patients use multi-factor authentication to be able to access their health data, which was at the time in the past has been very burdensome. But with the facial recognitions, one-time PINs, and all these other advances that are beginning to into the phone, I think over time we're going to see that citizens are becoming less desensitized to get it, and it may be more actually easier to secure that information and access to it.
Stacy, did you?
I did. So as we move to this area where we're having the convenience of the consumer products, we want to make sure that we're tracking and keeping an eye on people who want to get into our information. And so we do have a research program that is looking at trying to ensure that if someone is trying to spoof our biometrics, whether it's the fingerprint, the iris, the voice, that we are aware when that is happening. So on the same side that we want to make sure for a consumer product that it is convenient for them, we want to make sure that there are protections in place to prevent someone from using it, misusing those particular security protections, and using that again, unfortunately, against the person to get the data that should be protected.
You know, when I think about the Hollywood take on that, you know, you think about somebody cutting off somebody's thumb for the thumbprint or, you know, something along those lines. But it is possible to spoof some of these things, is it not?
It is. The level of sophistication varies, but you don't necessarily need to be very sophisticated for some of the protections that are in place.
Jean, you had something to add?
I was just going to bring you back to, we're talking about, right, the Internet of Things and mobile devices. But if you remember a couple of weeks or so ago, that came out in the news about Fitbits, right? And the Department of Defense is actually looking at even something as simple as that, because they've realized now that just because that Fitbit lives online, right, for very beneficial reasons for a user, from an adversary point of view, there's a whole lot of information that can be gained. So I caution us that when we talk about new emerging technologies and mobile devices, we really need to think beyond just the simple mobile phones, laptops that we, the government, generally look at, but we need to go beyond that, right? And it is a tough area for the Department of Defense, particularly within the intelligence community. I don't think any of us have really good answers for that yet. That's just an area we're still kind of working our way through to strive to figure it out.
But I think one of the answers that we probably can all agree on now, but maybe didn't years ago, was it's not going to be okay just to say you can't use those
Right.
kind of devices, right? We're
You
going to have to.
You can't bury your head in the sand, but we don't have the technological ability to actually come up with those solutions yet. So it's a balancing act for many of us.
So while we're on the subject of emerging technologies, are there any new technologies or approaches on the horizon that you ladies think can help in this area? I mean, blockchain, geofencing, crowdsourcing, AI, virtual enhanced reality. Stacy, I'll kick it off to you first as the IARPA rep on this panel.
Thank you. With respect to cybersecurity, we do have one program that we're running right now called CAUSE, which is trying to forecast cyber attacks. So how do you get to know that a cyber attack is coming days to weeks earlier than we typically can? And we're using this by looking at a lot of publicly available information, such as social media, such as blogs, to include going to the dark web, but also some non-traditional sensors. For example, if you put thermal sensors around your servers and you notice heat signatures that are increasing, you might think that something is happening there, especially if it's happening at hours that it doesn't normally happen. So how do you look at all of these non-traditional means of knowing that something is potentially different about the information being accessed at that moment in time, so that you know to go look and figure out what's happening?
So are you saying that help me connect the dots between the heat sensors and some cyber security activity? Are you saying that if somebody was accessing a server at night, it might heat up?
When a server is being used significantly to move a lot of data, there is a natural increase in temperature. And so yes, for example, if something is happening off hours where the data that's out there is fantastic. I mean, there's a lot of information that we know about our systems, when they're working, when they're at peak, when they're not. So if you have some peak activity to include these heat signatures at an hour of the day that just normally does not happen, you probably know that something's going on there that you should look at. So how do you find all sorts of non-traditional means and sensors to trigger the fact that you should go take an extra look at something? And so we're trying to bring in methods like that just haven't traditionally been used as a cybersecurity approach, putting them all together and just seeing what we can learn to help those who are doing analysis in the traditional ways.
That's where you kind of get into the big data, right? All of us are talking about big data. It's pulling into all of those data sources and then figuring out what questions are you trying to ask with all that available data to give you answers, like she brought up.
And then I'd also say, because of the distributed nature of data that's growing all the time, there's also the desire to use things like blockchain or distributed ledger to be able to authorize and access these different data endpoints.
So Trish, you get to work across a lot of different government agencies. What are you seeing in terms of innovative technologies that are maybe being used in different ways that could actually help with cyber?
An area where an innovative application of blockchain that I've recently became aware of is a project that we're actually working with the FDA, and they are trying to predict provide capability for future pandemics. And they've set up information sharing mechanisms between the FDA, hospitals, and other health organizations to share information about the effectiveness of drugs to address the pandemic. And the use of blockchain enables those communities to define the communities with which they want to share, make others aware that they are sharing it, and in that way the FDA is much better able to predict the effectiveness of the drugs that's being released to address the pandemic. I found that to be a very interesting use of blockchain in terms of collaboration, while they also were employing traditional encryption techniques to protect the privacy of the data.
I've heard it speculated that blockchain, I mean, most of the people think about Bitcoin and cryptocurrency, but I've heard some people speculate that blockchain is inherently more secure. And in fact, I've heard people go so far as to say that it is, unbreakable. What's your view on that?
So I would say just the opposite. Blockchain is very good at which I'm really curious about with the FDA, that it has pointers to information and dates and times and signatures, but the idea of putting a health record directly on a blockchain, that even if it's encryptions can be broke. So it may be the idea that you have pointers to information that is off-chain but not necessarily directly on the chain, and they could be private networks or something to the side. But as far as it being the end-all, the base safest to place to be, who knows, that blockchain may be the next vector that cybersecurity will be attacked, because that is where the data then is being placed. So that could be the next, who knows, who could speculate.
I'm your moderator, Gigi Shum, on the panel discussion, Women of Washington, Cyber Engineering, sponsored by Booz Allen Hamilton on Federal News Radio 1500 and federalnewsradio.com.